Welcome, this is the Florida Center for Functional Medicine, and I want to talk to you about ADHD. Current research is showing that about 9% of American kids have been diagnosed with ADHD. 9%. Now, what do you look for in terms of ADHD? Well, you're looking for a child who has difficulty concentrating, maybe is very impatient, has trouble staying organized, fidgety, and gets bored easily. What I want to do is give you some suggestions in terms of diet and also in terms of supplementation that you can implement in your life that can help a child that has ADHD. There are basically 5 main foods that you should get eliminated right away if you're struggling with ADHD or if you have a child who's struggling. Number 1 is sugar. You have to get rid of sugar because what happens is you get a sugar spike, and that's when you're bouncing off the walls. So that's when you're really hyperactive, and then you go through a dip where the blood sugar crashes and you're very lethargic and lazy, so to speak. So you go up and you go down. So high protein, high fat, high fiber. Watch the sugars. And try and get rid of carbs. The best you can do, because a lot of carbs turn into sugar, which is what we'll talk about later. So number 1 is sugar. So number 2 is when we talk about gluten. We're talking wheat, barley, rye oats, and this is something that we test for in our offices. So we test 100 different foods to see how the patient reacts. But if we see a big spike to say wheat, barley, rye oats, then we know we have a gluten issue. So number 2 is gluten. So watch out for those cereals and processed breads, that kind of stuff. Number 3 is going to be dairy. Watch out for dairy, especially for cow's milk. So we recommend patients shifting over to almond milk or coconut milk or one of those other alternatives. Number 4 is going to be artificial sweeteners. So watch out for aspartame, which is in a lot of gums and candies. Watch out for aspartame that's in Splenda, high fructose corn syrup, and watch out for the things that they put that in. Sweeteners can really mess with the patient's nervous system. Number 5 is going to be soy. So soy is GMO. It's going to mess with hormones and the hormone dysfunction that can lead to ADHD. So these are the big 5. So number 1 is sugar, and I go sugar-free the best that I can. Number 2 is going to be gluten. Number 3 is dairy. Number 4 is artificial sweeteners. And then number 5 is going to be soy. Now, what can you do in terms of supplementation that can help with ADHD? Number 1, I would get on a good fish oil. So about 1,000 milligrams per day of good quality fish oil. Fish oil is crucial for brain function and the development of your nervous system. And it's also a potent anti-inflammatory, so you want to get a good fish oil. Number 2 is going to be a good probiotic. Probiotic is good for your gut health. It's good for your immune system, and we know that there's a connection between ADHD and digestive health and your gut function. So there's that connection, so you want to be a good probiotic. Number 3 is going to be a B complex, specifically B6, which is necessary for the formation of serotonin. Number 4 is a good multivitamin. So we know that if there's any deficiencies in magnesium or calcium or zinc, that these can exacerbate ADHD symptoms. So you want to make sure you have good quality multivitamin. So to review, fish oils, probiotic, B complex, and multivitamins. So these are the core that you should be on if you have a child that is struggling with ADHD. So I hope you found value in this video. If you have any questions, feel free to contact the Florida Center for Functional Medicine.